Hi, today let us discuss if sciatica can return. Sciatica, as you know, is one of the most horrendous pains known to mankind. It is so severe that if you have experienced it once and it happens again, you can spot it immediately. So today's patient is Mrs. E. She had been operated 2 years back by a L5S1 right-sided microscopic discectomy. At that time, she had sciatica, which meant that she had a pain shooting from the right buttock below the knee to the right ankle, and it was associated with weakness and numbness at the ankle. After the surgery, the sciatica pain subsided, the motor weakness improved, but the numbness on the outer aspect of her right foot remained. It had remained for 2 long years. So today, when the sciatica struck again, she came straight to the hospital asking to see a neurological specialist or a neurosurgeon and seek what was the cause of the sciatica. Recurrent sciatica or return of the sciatic pain could be seen in about 25% of cases who undergo a simple micro discectomy, whether under the microscope or under the endoscope, in about 4 years' time. If a fusion has been carried out, the figure stands at roughly 10% over a 10 years' time. So, how do we evaluate a patient who has presented with a recurrent sciatica? The first thing is to ascertain whether the sciatica is exactly at the same location as it had happened the previous time. In Mrs. E's case, it was the same location. But surprisingly, the pain was on the right side, but on examination, we found that she had neurological deficit, which included weakness of the great toe on the left side. Puzzled, she asked what was the cause that the sciatica is on the right side, but the deficit is on the left side. So I informed her that the disc which is herniating has not read the book. And we had a great laugh because the thing is that the disc or the disc which is pertaining to the nerve root occupies a space which is roughly 18 to 24 millimeters. And so if there is a recent disc herniation, the toxins which are released by a leaking disc can cause symptoms on the contralateral side. I also informed her that over a period of time, if a disc is not functioning properly, then the disc which is located above or located below could come under stress and herniate. So she could either have the disc symptoms arising from the same side, or she could have an adjacent segment disc which could be at a level higher or lower than the previously operated disc. Also at this time, the pain in the back was to the right. This gives an indication that possibly she is having changes in the facet joint, which is a joint which is located at the back. So any recurrent sciatica needs to be viewed with suspicion, and it should be examined by a specialist to quickly sort out the level of the disc herniation